Okay, so these are the studies that I have been looking into and took as a reference to what I should be giving Kiara when it comes to Sorafenib. So, Ivermectin synergizes with Sorafenib in hepatocellular carcinoma via targeting multiple oncogenic pathways. This being ivermectin stagnates the growth, and Sorafenib actually increases the rate in which they break down. So it basically stops it from growing, and then Sorafenib comes up and starts breaking it down. And in these studies, the main thing that I wanted to look at were some of these graphs, like this one right here. Uh, this is what you would look at for growth over time. So this is the tumor size here on the left, and this is drug treatment over time. And as you can see, ivermectin and at specific doses with a higher dose seems to stagnate the growth of the tumor cells uh, exponentially, or I guess in a 1-to-1 ratio. So if you double the amount of ivermectin dosage, it's going to stagnate the growth by double. Because you see here the middle line, the dotted line is ivermectin at 5 milligrams per kilogram, and ivermectin at 10 milligrams per kilogram is the longer dotted line. The longer dotted line showing it decelerated the growth rate almost by double of what the 5 milligram rate was, compared to the control group, which was no ivermectin at all. So this is an indicator of how much it stagnates the growth of cancer cells, but it doesn't decrease the amount of, doesn't make the cancer cells go away. Of course, if they did more studies on how much more you take and it possibly getting rid of your cancer cells, that would be awesome as well. Only problem is then you get to a point of toxicity where it could be an overdosing factor in seeing serious side effects. Now, this is where it gets really interesting down here at this table. So this table, it's the same table as above, but this is Sorafenib ivermectin and a combination of the both. So ivermectin is the dotted blue line, Sorafenib is the dotted green line, and the solid black line is the combination, whereas the red line is the control group. So as you can see here, ivermectin stagnates the growth. Sorafenib does the same thing, Sorafenib does the same thing. It stagnates the growth, and they're very similar. Sorafenib may actually have a better chance of decelerating the growth, but you can see between these dashed markers along the lines, that's the average rate. So this study was conducted in mice, and the dashed lines here is the size of each individual mouse, and the line goes through the middle of them, determining that's the average in which it grew. So over the amount of mice that were tested, they had a growth of right about here on the lowest end and right about here on the highest end. So the average is right in the middle. So the lines are through the average. The line is the average rate of growth. So you can see with Sorafenib, it slows it down more than ivermectin does, but with the solid black line in combination, it slows it down and then starts getting rid of it, meaning it starts to get smaller. And you can see with these dashed markers, it's very, very consistent in comparison with the growth rate. So the more it's taken in combination, you can see that the averages are a lot closer together, which means it's very, very consistent. That kind of data is very, very rare. It's awesome to see. We want consistency as much as possible. So that's the information that we have on the combination of ivermectin and Sorafenib in combination. So what is Sorafenib? And what it is these guys right here. It is a tyrosine kinase inhibitor and promising therapeutic tools for cats with HER2 positive mammary carcinoma. So the tyrosine kinase inhibitors is what Sorafenib Sorafenib and Ivermectin are. They're the same thing, but they target different locations based on the chemical compound grouping. So these ones, the tyrosine kinase inhibitors for mammary carcinoma, is a specific type of inhibitor for the tyrosine kinase inhibitors. But Sorafenib, let me zoom in. Sorafenib can treat multiple tyrosine kinase in cancers. So it's the same exact thing as ivermectin as a tyrosine kinases. So we can assume, and this is just an assumption, this is not fact, it's an assumption, cats will react to sorafenib the same way they react to ivermectin, because ivermectin is the same thing. It's a tyrosine kinase inhibitor. So, with that being said, right over here, we look at the toxicity of sorafenib and its exposure over time. How much are they allowed to take? Look at this right here. This is in humans, patient characteristics, and sex, age, yada yada, and how much they took percentage. Or no, not how much they took. That's the percentage of averages of the age and whatnot. I went too far, didn't I? Where's the... So the results for 83 patients, median age 16 years, range 21 to 84 years, median sorafenib 12-hour area under the curve, yada yada, was 52.8 milligrams, and a total of 51 patients, 61%, experienced grade 3 to 4 toxicities, including hand-foot skin reactions, 23%, asthenia, 18%, and 11% diarrhea. Sorafenib, preceding grade 3 to 4 toxicities, was significantly higher than that observed in the remaining population, 61.9 milligrams, versus the 53 milligrams. In 25 patients treated with fixed doses of sorafenib, for the first 4 months, median dose normalized on day 120 was significantly lower than on day 15, 63 versus 102 milligrams. This incidence of hypertension and hand and foot skin reactions significantly decreased over time. So it's almost like your body builds some kind of resistance to it over time. So in conclusion, sorafenib decreases over time, similarly to the incidence of hypertension and hand and foot skin reactions. Monitoring of sorafenib plasma concentrations may help to prevent acute severe toxicities and detect patients with suboptimal exposure and decrease at disease progression. So the worst that I have read through these studies is that one of the most severe side effects is blisters on the hands and feet. So with cats, I don't know how serious it can get. There's no studies on how serious it can get. And let's see if I can find that study about dogs with sorafenib treatment. Yeah, this one. Data in dogs. Sorafenib for the treatment of unresectable hepatocellular carcinoma, which is what Kiara has. Activity in dogs. So if we go down to... here it is. Dogs and tumor characteristics. Nope, that's not what I'm looking for. For the dosages that they gave the dogs. Treatment and toxicity. Here we go. 7 dogs received oral sorafenib. Median treatment duration was 228 days, range 168 to 321. At data analysis closure, 5 dogs had discontinued treatment due to drug unavailability, and 1 dog due to PD after 168 days. 1 dog had died from tumor-unrelated causes, leishmaniasis. While still under treatment, the dog experienced PD over and received 1 transarterial chemoembolization after having interrupted Sorafenib. 2 of the 5 dogs had discontinued the treatment. 6 dogs were treated. Median duration was 21 days. Concerning toxicity in the Sorafenib group, 3 dogs developed cutaneous toxicity consisting of one of each of the following: grade 2 alopecia, so hair loss, grade 1 hyperpigmentation, and grade 1 localized erythema and alopecia. 1 dog also developed grade 1 diarrhea that resolved uneventfully with symptomatic treatment. Routine liver tests were monitored during Sorafenib treatment. Bilirubinemia and serum transaminase elevations did not occur. In the MC group, the dogs experienced gastrointestinal toxicity, 2 of grade 1, 1 of grade 2. 1 dog experienced grade 1 hemorrhagic hemorrhagic cytitis, and 1 dog experienced grade 1 renal toxicity. In the groups treated, treatment-related mortality was not observed. So this means there was no cause of death from the Sorafenib. So it means it was safe dosages for these dogs. Based on the questionnaires results, quality of life was improved in 6 of the 7 dogs receiving Sorafenib, whereas 1 dog in the quality of life was just maintained. Only 3 of the dogs receiving MC lived long enough to assess quality of life. In 2 of them, quality of life was improved, whereas the last dog, quality of life was maintained. So there was no negative side effects for the quality of life from Sorafenib. All right, so what we're looking for is the dosage in which they gave the dogs, which I'm pretty sure was 5 milligrams per kilogram, if I can find that. Discussion, materials and methods. Treatment protocol. Here it is. Sorafenib treatment was offered to all dogs. If owners rejected Sorafenib, dogs received MC. Sorafenib was administered orally at a dose of 5 milligrams per kilogram twice daily on an empty stomach. The dose was administered to the nearest 50 milligrams. This on an empty stomach. I've also seen in other studies with humans, you don't want to take it with food. You do want to take it with a glass of water. So that's going to be one thing that we really need to pay attention to when it comes to Kiara. Giving it to her on an empty stomach with some water. So we'll figure out how to do that. I'm thinking we'll weigh out a piece of Sorafenib and toss it into her mouth and take a small syringe and shoot a bunch of water into her mouth at the same time that the small piece is going in, so that she does get water with the medication. It'll also help her swallow it easier. This is, again, flying blind. We don't know how she's going to react to it. So it's going to be a very, very small dose at first. But judging off of this, 5 milligrams per kilogram for a dog, we're probably thinking 1 milligram per kilogram for a cat, just to be safe. Like, that's 5 times less than what the dogs will take. Because even with dogs and cats taking ivermectin, it's very similar. The amount of milligram per kilogram on a dog is about the same as for a cat, at least if I'm remembering right. They were very similar. So we're gonna go 1/5 of what the dogs are supposed to take and see how she reacts to that. But also, since ivermectin synergizes with Sorafenib, we're gonna make sure that we bring down the dose of ivermectin as well. Because if it synergizes so well that it causes a serious reaction because they both work in tandem so well, then we want to make sure we avoid that. So we're going to bring down the dose of ivermectin as well as bring down the dose of Sorafenib and see how she reacts to that. We're also probably going to space out the time she takes ivermectin from the time she takes Sorafenib by about anywhere between 6 and 12 hours, just to be on the super, super safe side. Let her body kind of digest it and then get to another empty stomach and then give her the next medication. So we'll see how that goes. I'm also thinking before we do the combination, we'll give her a very small dose of sorafenib to make sure that she can handle that by itself and see how she does. If there's any side effects, if it's dangerous, we'll know right away before giving it in combination with ivermectin. So we're going to take this very slow. We're going to be very safe and cautious about it, very low doses, and see how she handles it. If she handles it well, then next week we'll do the combination with ivermectin. If she handles that well, we might increase the dosage and see how she handles that. And if we do increase the dosage, we might just sit with that until we go in for another ultrasound to see if it's affecting her cancer cells and her tumors. So that's where we're at right now. And you've seen the data on sorafenib. You've seen the data on how it synergizes with ivermectin. I showed you that it is a tyrosine kinase inhibitor, just like ivermectin is. So she should, in theory, respond the same way. And after talking to oncologists and toxicologists, the main thing that they all seem to agree on is that it is an off-label product for dogs and cats, sorafenib. It is an off-label medication for dogs and cats, which means dogs and cats can take it. However, you have to find clinical trials in order to get it prescribed. Could not find any in Colorado, and I tried my best. I could not find any in my state. None existed. So we're on our own. And I bought some online. It's being shipped to my house. Most of it is coming from an online pharmacy in India, because everything is over the counter there. You can order it without a prescription and they'll just ship it straight to your door, which is awesome, because I don't know why that's not a thing here, especially when it's been studied for so many years, because I'm pretty sure sorafenib has been around for at least 20 years, just like ivermectin, because it's kind of in the same sister group, but targeting different parts of the tyrosine kinase inhibitions, I guess, however you would say that. Anyways, point is, in combination, these have shown amazing results in mice. I don't see why it wouldn't show similar results in cats. It's shown similar results in dogs and humans. So hopefully we'll get the same results in cats, but since there's no data on whether or not it works in cats, we're going to make sure we take it slow, make sure she's safe, make sure she's okay, no side effects or anything like that. If there are side effects, we take her straight to the emergency vet, let her know what she's taken, and hopefully they can get her some fluids and whatnot and flush it out of her system and get her back to normal. And then we'll go back to the drawing board and start over. But that's where we're at right now. That's the information on sorafenib and why we're going to be doing it in combination with ivermectin. So I hope this explained well enough why we are doing it this way, and hopefully this ends up completely getting rid of her cancer, and she can go back to being a normal, healthy kitty running outside and trying to catch mice who hopefully don't have cancer and need a combination. But with that being said, I hope this helped you guys understand how and why we're doing it this way. And we'll be back hopefully next week with another update.